listening to 40 Weeks, a production of the Pregnancy Podcast with Vanessa Merton. Visit pregnancypodcast.com/week for all of the 40 Weeks resources and sign up with your due date to get each episode delivered to your inbox when you start a new week of your pregnancy. Thank you for tuning in to the 40 Weeks podcast. Welcome to week 29, only 11 weeks to go. You can see a picture of what your baby looks like this week, read the transcript, and access all of the additional resources at pregnancypodcast.com/week 29. Your baby eggplant is growing this week to the size of a cauliflower. They measure 15.5 inches or 39.3 centimeters, and they weigh 3 pounds or about 1.4 kilograms. Every day, your little one looks more like a full-grown baby and less like a fetus. Your baby will double or even triple in weight between now and the time that they're born. More fat is being deposited under the surface of their skin, and their wrinkles are smoothing out as they're plumping up. As your baby grows, you're going to feel increased jabs, pokes, and kicks. While it can be uncomfortable, just think of it as your baby saying hello and reminding you that they're in there. They're getting stronger every day. They're responding to all sorts of stimuli like movement, sounds, light, and some of the foods that you eat, especially sugar. The placenta has also been growing over the past 29 weeks. By this time next week, it will weigh almost 1 pound. The top of your uterus is now 4 inches above your belly button. The bad news is that it's crowding your ribs and your diaphragm, and it may leave you short of breath. It's also pressing against your bladder, so you may need to urinate more often. There are some complications that can arise in the third trimester. One is PUPP, P-U-P-P-P, which stands for pruritic urticarial papules and plaques of pregnancy, or PEP in the UK, which stands for polymorphic eruption of pregnancy. This is an itchy rash that is the most common skin condition in pregnancy. Intrahepatic cholestasis of pregnancy is a complication that's caused by a reduced flow of bile down the bile ducts in the liver, and this causes some bile to leak into the bloodstream. This buildup of bile acids in the bloodstream can cause a persistent itch. Most often, this happens in the palms of your hands and the soles of your feet. It's also possible for it to spread to your belly. This condition does increase the risk of some adverse outcomes for your baby. Please bring up any symptoms with your doctor or midwife. As your uterus grows, it can put additional pressure on your veins in the lower half of your body, especially your legs, and that causes your veins to work extra hard. On top of that, progesterone can relax your blood vessels, and that can contribute to spider veins and varicose veins. Spider veins are tiny red or bluish veins that can appear on your legs. Other than changing the appearance of your skin, they're painless. Varicose veins are more prominent, protruding veins. These have the potential to be uncomfortable. Varicose veins are hereditary, but the good news is that you can do some things to treat them if they show up. For more information on varicose veins, spider veins, and some of the other skin conditions that we've talked about this week, visit pregnancypodcast.com/skin. As you're getting closer to your labor and birth, there's an excellent tool for evaluating any intervention, and that is the BRAIN acronym. Any intervention should only happen with your informed consent. That means that your care provider takes the time to explain the risks and benefits and that you can opt in or opt out. Here's 5 questions that you can ask your doctor or midwife about any intervention. B stands for benefits. What are the benefits? R is for risks. You want to ask what the risks are. A is for alternatives. What are the alternatives? I stands for intuition. What does your intuition tell you? And N stands for nothing. What happens if you do nothing? Many interventions are available for labor and birth, and each of them has risks and benefits. You should be working with your care provider to make informed decisions that are right for you. You can prepare for conversations with your doctor or midwife by educating yourself about things like vaginal exams, electronic fetal monitoring, IV fluids, episiotomy. And there are episodes of the Pregnancy Podcast that cover every intervention in depth, examine the evidence, and take a look at all of the risks and benefits. A tip this week for dads and partners: whether you're decorating a room in your home or you're just carving out a corner for your baby, the nursery is often one of the biggest to-do items for expecting parents. If setting up a nursery involves painting or lifting heavy objects, please volunteer to take on those tasks. Don't panic if the nursery isn't 100% done when mom goes into labor. The American Academy of Pediatrics recommends that infants sleep in the parent's room close to the parent's bed, but on a separate surface designed for infants, ideally for at least the first 6 months. So remember, it will be at least 6 months until your baby is spending nights in their own room. Thank you for tuning in to the 40 Weeks podcast. You can see the full transcript and all of the resources for this episode at pregnancypodcast.com/week29. Next week, your baby's brain is changing from smooth to grooves and indentations as their brain is developing. Until then, I wish you the very best in your pregnancy journey.